whether any individual dog is going to develop clinical signs and it actually affect their life, and at what age it's going to affect their life. So it can display in a lot of different ways. And then we have OFA and PennHIP as two different ways to evaluate hips. Okay, for some reason. My cursor keeps disappearing. Okay, so what actually causes it? What really is the disease process? And it's fairly simple. If you look at this picture on the left-hand side, you see these hips, and you'll see this little pink ligament that's inside the joint. That ligament is what helps hold the ball in the cup. And when the ligament is too long, then the ball can slide out and ride on the edge of the cup, and that's actually what wears it out. So when we look at these diagrams on the right-hand side, you see this normal joint and all those little arrows pointing to the surface of the ball and the cup. And that's the way the joint should work. You should have, the force from the dog standing, pushing the ball into the socket. The glutes, that's the arrow kind of going at an angle. The gluteal muscles sucking that ball into the cup, into the acetabulum. And then the dog bears weight over the whole surface. So if this ligament is long, then that ball is going to ride out on the edge of the cup and wear it out, which is really what that middle picture is demonstrating. So instead of having the force distributed over the surface of the ball, all of a sudden it's like a pinpoint pressure that starts digging into the head of the femur. And that's why we get it, so much degenerative change, why they just wear out. And eventually, we have the body responding by trying to stabilize the joint. You get all this extra bone and it just becomes a mess. And so worst case scenario, we go from a ball and a cup to a mushroom and a dinner plate, where it just isn't really a very functional joint, and where that ball will, in worst case scenarios, be completely out of socket. And eventually these dogs will sometimes rupture that ligament because it's also being stretched across that point. And that's when they, start to, luxate their joint. So what we're really trying to eliminate is laxity. If you can make this ligament shorter and make those hips tighter, then you won't have hip dysplasia. So OFA was something that started in the 60s. We're all very familiar with it, and it's a subjective evaluation where we have a radiologist somewhere reading these films and giving us their impression of them. And so, it's a good screen to eliminate really dysplastic dogs that are obviously need to be eliminated from breeding. It's not as good at hip laxity. So if you look at these two hips on the right, the one at the top, obviously these hips are very loose, and this dog is not going to pass OFA. The problem with OFA and laxity, though, is when you get to the good dogs, like the one at the bottom, it has a hard time telling us, is this dog going to have hip dysplasia? And most of the time people will say, well, no, this is a good, excellent dog. They won't have hip dysplasia, but that's not necessarily true. So what problems we get into and why we still have hip dysplasia is that we can't evaluate laxity with OFA as well. And so you can't tell which of the good and excellent dogs are going to produce puppies that have dysplasia. And so that's really one of the big differences. So this is that same dog with his hips at the bottom, and you can see that they look good, but when you try and push the joints out of the balls out of socket, they come about 75% of the way out of the socket. So this dog is actually at pretty significant risk to have hip dysplasia. Not by the time they're 2, but if you re-radiograph this dog when they're older, you'll probably find something. How that affects the dog, we don't know. Both of these tests, OFA and PennHIP, are screening tests. They're they're really trying to tell us what's the risk, not predict the future, right? We can't look at a dog and say, well, his hips look like this, and he's going to have these effects at this age. It's very variable. When I was in private practice, I remember a lab, they had a hard time catching this lab. He'd broken his femur, and they couldn't catch him because he kept jumping fences from yard to yard. And when we radiographed him to look at his femur, I couldn't really imagine how this dog could stand. His hips were so bad. And so sometimes you'll have, really severe arthritis in their hips, and they won't show it clinically. Other times you'll have mild to moderate changes, and it'll affect the dog a lot more. And so that's one of the things that neither test can really do, is tell you exactly for this individual dog, what do these hips mean down the road when you have a dog that's dysplastic. But the laxity issue, and being able to look at laxity and detect it using OFA is it's good for the dogs that are dysplastic. It's harder when you get excellence and good. And that's pretty much displayed. This is from OFA. This is a paper that came out in 2011. It's pretty much displayed by the numbers. So if you look across the top, that's the dam and their OFA rating. And if you look at the sire on the left-hand side, those are the OFA ratings. So if you breed an excellent to an excellent in this group of around 18,000 dogs, there were 3.6% dysplastic puppies. And if you breed good to good, then it goes to 9.6. And if you breed fair to fair, it's almost 20%. Now, that doesn't mean that every excellent dog is going to have 4% dysplastic puppies. It just means that in this group of parents, there are excellents who are throwing dysplastic puppies. And as you go to good and fair, then you just get more and more because you're having more laxity. And so this is really more typical of what's going on. So this slide on the left is 2000 Goldens. It's actually from a guide dog school when they switched from OFA to PennHIP, because they have a group of dogs that they don't bring in new dogs. They have so many dogs. They have about 300 dogs at this facility they use for breeding, and they just do a Wright's coefficient of inbreeding and breed the least related dogs. But the one thing they could never get rid of was hip dysplasia entirely. And so if you look at this chart, at the bottom is the OFA scores, and on the left-hand side is the PennHIP score. And there's these two red dotted lines that I added. The bottom one, if you get below 0.3, which is really, when you think about PennHIP scores, it's a scale of 0 to 1. So at 0.3, you're really saying you can't get the hip more than 30% of the way out of the socket. So if you get below 30%, then they'll never have hip dysplasia. If you get above 70, which is the upper line, you will have some form of dysplasia. You're at high risk. And so what you can see is most of the excellents, they're settling down there by the line. They have some risk. There's some that are below 0.3, but in Goldens, we just have a hard time getting dogs that are below 0.3. And that's just due to how much laxity we have in golden hips.
Excuse me, can I interrupt you for just a second? You have a gray square that's viewed on the slides. It's kind of blocking some of the information. Shows your photo, music, and movies. Are you seeing that on your screen?
No, I don't see it. Wait.
Try starting it again. Yeah, try going full screen again. It's still there. Weird.
Huh.
Okay. It disappears when you do that.
Is it back now?
It's no, you're still, yeah, you're still in the, let's see what happens. It comes back when you hit play. Maybe just, yeah, it comes back when you do that. So weird.
Huh. Should I just try and restart it again? No.
So I think actually if you, you
try
have your,
just move it to a new window and see if.
nope, it's still there. It does better. It's just kind of blocking part of the stuff there. So I don't know, it's this slide, when you just do it this way, if you can just like click to each slide, it might be better.
Yeah, okay.
Oh, okay.
Yeah. Okay, so let's do that.
Okay, actually it's kind of blocking there too, so I'm not quite sure what the answer is. If anybody knows how to get rid of that, raise your hand in chat.
Still there?
No, it's not. Yay.
Huh.
You're all good now. Woohoo.
Okay.
Thank you.
So if you look at like on the right-hand side, you can see how the excellence are, they're down there by 0.3, but the dogs that are up here in this yellow circle that I made, those are the dogs that are excellent, but are going to have hip dysplasia. And then the next group, which actually this is from a talk, but they mislabeled them at the bottom. The next one to the left are good dogs that are good. Again, you have some OFA goods that are below 30%, but you have some that are over 70. So these dogs are really passive carriers of hip dysplasia. And so you think, well, we have an OFA excellent, we're not going to have any dysplasia. But as we saw in that last slide, breeding excellence to excellence, it's still possible if the parents have a lot of laxity. And that's really what PennHIP was designed to do, was to evaluate that laxity. So for Goldens, our average is around 0.56. So that's pretty loose. It's over 50% of the way out of the socket. Vizslas are a lot better. Vizslas are about 40% on average. That's the mean PennHIP score. And so y'all have a lot less laxity than we do. And we'll talk about what that means. So one of the things, that's always kind of been a gripe of mine about OFA is they don't publish anything. They don't do any studies. Like, what does a dog at 2 look like when they're 10? And no one's done that study. We just said, well, they look good at 2 and off we go. If you look at the Purina study, the lifetime study that they did in labs, where they were looking at the effects of weight on the joints, particularly on hip dysplasia, 55% of the dogs that passed OFA had arthritis when they died. And so, unless your hips are really bad at 2, you have a lot of laxity and you already have arthritis, if you're going to develop that later in life, obviously, unless we go back and radiograph them again and look at them, we're not going to catch that. But this is something OFA's never really looked at, is we shoot all these x-rays at 2, but what's it mean later in life? And so we've had some dogs where, they were OFA good, and we bring them in and they're 6 or 7 and they have arthritis. And it seems like that's not possible, but if they have laxity, It certainly is. The other issue is that 2 years is just, it's a very long time to wait before we look at the hips. But at the same time, in certain breeds like labs, if a lab is dysplastic, only about a fourth of those dogs will have arthritis at 2 years old. So they're very late developing it. And part of that has to do with how much muscle mass they have. So like their glutes holding the ball into socket. So really for labs, 2 years of age is too soon to do OFA if you're looking for actual signs of hip dysplasia, as evidenced by arthritis. Now, dogs like German Shepherds, who also have a lot of problems, about 95% of them will already have arthritis at 2 years old if they're dysplastic. So there are breed differences, but this is one of the things that has always sort of bothered me, is that we're saying these dogs are excellent or good when they're 2, but we don't really know scientifically. No one's really done a study to tell us what does that mean later on in life. So PennHIP was started in the 90s. PennHIP stands for Pennsylvania Hip Improvement Program. And really the big difference is just, we take the OFA view and we look for arthritis. And then we take 2 more images and we measure the laxity of the hips. So in some ways, they're the same in that they're both using the hip extended view where they're on their back and we stretch them out on the table. But then PennHIP does a more sort of functional test where the dog's in more of a standing position, and that measuring their laxity tells you more about what's happening when they're standing and when they're moving. Is that ball popping in and out of their hip socket? So we do most of our dogs at 16 weeks when they're pups, just to get an early look. It's consistent between 16 weeks and a year of age, but if you're not really interested in looking at them when they're really young, there's more agreement between a year of age and 10 years than there is 16 weeks and a year. So, if y'all were my clients, I would say, let's do a first look, like a year, because that's going to probably be a little bit more consistent. But as I said, you get this laxity score that's 0 to 1, and you can just think of it as how far can you get the hip out of socket. This is a passive movement. It's not hard to do, and we all get sort of the same result, a consistent result, if you apply enough pressure. So when you think about the hip joint, it's not like it has a spring where, like, the stronger you are, the farther you can pull it out. It's really more like a rope. You can get it out so far, and then strength is not an issue. You literally it goes so far and you can't move it any farther. And so as long as you're providing the minimum force to slide the hips out of socket, then we'll all get the same result. It makes it a very consistent test. But if you've seen PennHIP scores, if you have a 0.3, that means the hip will only come out about 30%. And so that's the bottom sort of cutoff, where if you're below 30%, you're just not getting enough sliding of the ball in and out of socket to cause arthritis. But if you're 70%, if you're 0.7, then you're going to have some wear and tear. Again, it doesn't mean your dog's going to, even be lame. But if you took x-rays of them later in life, they would have some degree of arthritis. So it's really a function of how far can you get that ball out of socket. So this is the standard view where we're pulling their legs down. And this is, really, it works against us seeing laxity if there is laxity in the joints. because it's not a normal position for the dogs. And the farther you pull that down, the tighter the hips get. So that is due to the joint capsule. So, you have the ball and cup, and then you have this joint capsule that goes around, and that's what holds the joint fluid in. And that's a very fibrous capsule. So as you turn this hip, you're actually twisting that joint capsule, and that's causing the hip to screw in. And so, pulling them down in this position actually makes them look better, with less laxity than, than they really are. But it's the exact same view as OFA. And what PennHIP uses this view for primarily is to look for arthritis and signs of hip dysplasia.
Quick question on this particular view. Do you find a lot of difference between sedation and no sedation?
I do. I mean, I find it's a lot easier to get them positioned correctly, but it depends. It kind of depends on the dog a little bit, how much pain they can tolerate and that sort of thing, because there is there's some discomfort associated with it. But for the I can't say that I do a lot. Sometimes we'll do like if somebody want to just get 6 months, get a quick prelim and just get a look, we'll do it without sedation. But for PennHIP, you've got to have them relaxed. Like you just can't do it without them sedated. So 99% of the time I have them sedated. So I think if you're just doing this view, I think, you can do it without sedation for most dogs, probably. I find it a lot easier, especially when you get towards the end of fully extending and, pulling that joint, pulling their knees down, it gets more and more uncomfortable for them, and most of them will jump, and then it gets hard to keep them in position.
So I guess the question that's come up with the sedation versus non-sedation is whether or not you could actually change the rating.
For OFA or for PennHIP?
For OFA.
For OFA. Well, that's kind of the other problem with OFA. It's just subjective. So there are ways to make them look better. And if I have them sedated, I could, I can more easily do that. Particularly really pulling their legs down farther than they should be. Ideally the tibia should be parallel to the table, but if you keep going, you really are screwing them in farther. So with sedation, I think you can make them look a little better, but that's not, that's not really helping us if we're artificially making them look better than they really are, and so especially if that's due to laxity.
Thank you for that. There's been a lot of discussion about whether or not it just people thinking that they choose to not do sedation to get the best x-rays. But anyways, you answered it perfectly. Thank you very much.
Okay. All right. So when they look at this film, they're looking for, at PennHIP, they're looking for arthritis. So when you get a report, you're going to get a report back that says confirmed hip dysplasia. So they will give you your scores. And I do think, at some point, if you have hip dysplasia, it starts affecting your scores because you start getting fibrosis inside the joint, which changes, how it's evaluated. But it really doesn't matter if you have confirmed radiographic arthritis in the hips. It's not a dog that you're going to be breeding. So, it's not something where you can say, well, his scores are, better than the breed average or something. We're going to breed them anyway. If they have hip dysplasia, you obviously don't want to be breeding them. So they're going to fail this dog because of hip dysplasia. And it's, with PennHIP, it's not really pass fail, except when they find arthritis. And then they'll, in the comments, they'll say something about, shouldn't be breeding dogs that have arthritis. The second view is what's called a compression, where we're pushing the balls into the socket. This view, it's a little, it's the one at the top there. They're kind of frog-legged a little bit. And this one is so that they can measure how big the ball is and measure how big the cup is for calculating their score. And the bottom one is, what we use to measure laxity. So this distractor, the black bars, we lay that on their stomach, and I've got their legs and I'm pushing their knees together. And when you push their knees together, their hips just passively will slide out. And so what we're looking for is that black foam on the distractor to be compressed a little bit. It's kind of hard to show you, but that tells us that we've got an adequate amount of pressure and the hips are going to slide out, and then they measure them. So I don't score my own films. I send them off to PennHIP and have them do it. I know some people, I've tried to figure out if I can do it. And even though we've done 1,500, I'm not as consistent as they are. And so we always send them off. But this is how they calculate the score. So it's really, the distraction index is just how far you can get from the center of the cup to the center of the ball when it's displaced. So how far is that ball moving out of socket? And that's divided by the radius of the ball, and you end up with a distraction index. So like on this illustration, that's about 75% of the ball is out of the socket. And that's a dog that's going to have problems. So being able to quantify it, being able to put a number on it, a number that tells you really how long a ligament this dog has inside their joint, is actually something you can select for. You're really selecting for one specific trait, and that is how long this ligament is, because if the ball can't get out of the socket, they're not going to get hip dysplasia. All dogs that have arthritis in their hips have this kind of laxity if you measure it. The other thing about the percentages is, if you have a 0.5 and a 0.25, well, the 0.25 is, 50% tighter than the 0.5. So it actually, really gives you something for comparison. This is a report that you would get if you sent in hips to PennHIP. And so about halfway down, you see findings. This dog, this was Dorothy from the Golden Girls litter. So on the right, she had 4.5, and on the left, she's a 4.3. So for a Vizsla, that would be pretty sloppy. That'd be worse than your breed average. For Goldens, that's quite a bit better. And then right in that same findings box, they're going to list osteoarthritis. There's no evidence this dog has arthritis. Of course, she's 16 weeks old, so that's not too unexpected. And then at the bottom, they will give you this graph. And so this graph is for your breed. So this chart for Golden Retrievers is based on 24,700 PennHIP studies. And the little black dot in the middle is the breed average. And Dorothy is at mild risk for hip dysplasia, and she's better than the breed average. So she could be, a dog that you might want to breed if she was a Golden. But if you looked at this on the Vizsla scale, she'd be on the other side. She'd still be at mild risk, but compared to the breed overall, she's looser than half of the Vizslas that are out there. So, they tailor it to your breed, and you know, as they do more and more exams, you know, then, you know, at some point I can remember this is based on 12,000 Goldens or whatever. And now we're up to, you know, about 25,000. So that's what the reports look like. So what, you know, what does the laxity mean? Again, I put Vizslas and Goldens, you know, see where you are on the scale. But if you're less than a 0.3, so I've said before, if you're less than 30%, you're not going to have hip dysplasia. When you get to about 40%, you know, you just have a rising risk. You're going to have a, you know, less than 10% of those dogs are going to have problems. Really, if you keep that dog at the right weight and they have good plain nutrition and they're, you know, getting a decent amount of exercise, but nothing too traumatic, you know, that dog is not going to have issues. At 0.5, you go to 15%. By the time you get to 60% out, you're going to have about, you know, 40% laxity. So you can see Goldens as a breed are right on the, you know, the brink right there, right in between where we go from some problems to a lot of problems. And then when you get to 70% displacement, you know, those dogs are going to all have some form of hip dysplasia. Again, it doesn't tell you exactly what that means, just that they're going to have some arthritis. It may be undetectable, you know, to the owner. You know, it may be severe enough in some dogs that you know, it'd be debilitating. Of course, if you're a 1, you know, you're definitely going to have some severe disease because your hips are already all the way out of socket. Essentially, you're 100%, you know, out. So your ball is riding on the edge of the cup. So this is the scale for all the dogs, but then it varies, you know, a little bit by breed and how tight dogs are as the breed. You know, it's when you look at Labs, Goldens, Rotties, and Shepherds, even though all those breeds have a lot of problems with hip dysplasia, you know, like Rottweilers can tolerate a lot more laxity because of their muscle mass than German Shepherds can. Goldens and Labs are kind of similar and kind of in the middle, but that muscle mass makes a lot of difference in the wear and tear because their muscles just holding the joint together. Whereas Shepherds, with their kind of slope and a lesser amount of musculature, they're gonna have to be tighter. So really, if you look at it by breed, Shepherds, you actually have to get to like 0.27 or lower to say they'll never have anything. Whereas Rottweilers are closer to 4. They're like a 0.38 because of that muscle mass. So what does this mean for breeding? You know, one of the things we like about OFA, you know, you got an excellent, you got a good, you got a fair, you got dogs that don't pass. You know, it's really clear cut. The only recommendation PennHIP's ever made is just everybody pick dogs that are better than the breed average. And that's kind of the minimum. If everybody did PennHIP and picked dogs that were better than the breed average, then the breed average would go down and hip dysplasia would go away. That's really their philosophy about breeding. You know, the more selection pressure you use, then obviously, you know, the faster you can make changes. So, you know, if you're saying, well, I'm only going to breed dogs that are less than 0.3, then your hips are going to get better very quickly. For us, particularly Goldens, where the average Golden is 0.53, so 53% displacement, there aren't a lot of 0.25s. So, you know, my target really is to try and keep it somewhere around 4. You know, make a Golden Retriever more like a Vizsla, you know, and just you know, put more pressure than, you know, just saying, well, we're going to breed something that's better than the breed average. If I could find, you know, all the dogs that I wanted and, you know, that were under 0.3, and then obviously that would be even better. we could make change more quickly. But it's also a thing, you know, where you're selecting for a lot of other things, you know, their temperament and how they work and how they bond with people and all these other issues that we need as a service dog school. And so, you know, to me, something around 0.4 for Goldens is an acceptable risk because we can, you know, really monitor the dog's weight. And there's a small percentage of those dogs who might have an issue, might have some arthritis, but if they do, it'll be when they're very old and it won't affect their working career, and it would be medically manageable. So that's kind of my philosophy on that. Now, you know, does PennHIP work? This is a study that came out a few years ago from Auburn and their detection dog school. You can kind of see where they've been since the year 2000 with dysplasia. And the black bars are dogs that have dysplasia, white bars are the non-dysplastic dogs, and then the gray bars are dogs that are kind of iffy. And so you can kind of see how it goes. Started off pretty good, had a lot more problems around 2010 to 13, and then in 14 they started using PennHIP, and you know they really put the screws to it. They said, okay, we're not going to breed any dog who's over 0.3, and you can see, you know, 2015, 16, and 17, you know, they pretty much overnight got rid of hip dysplasia. And you know, if you can apply that kind of pressure and you have the kind of dogs that you know meet all the other criteria, it does work, and you can produce change very quickly. The last thing I want to talk about, you know, is things that we know. So heritability, you're selecting for this one trait. Really, how long is that ligament? And so you've got a very targeted thing that you're going after, and the heritability on it is about a 0.6, which is pretty good, but there's still a good bit that's not genetic. So you know, it's like any test. It's not an exact science, just in that there's some variability, but the heritability for PennHIP is much better, you know, than OFA, where we're looking at how do they look, and we can't tell how loose they are. But if you take that heritability and put some pressure to it, you're going to get genetic change. When we started using it back in 2000, and Lindsay will remember this, you know, that, you know, we would breed dogs, think, okay, we're going to get better, and then the litter wasn't as good as the parents. And so this is the one thing, I don't have a paper on this, but you know, it's something we've observed, and I know it's true, is that in general, the litter average is not going to reflect the parents' individual scores as much as it does the parents' litters. So for instance, this, you know, I made them the same so the math would be easy. But so if both parents came from a litter and there's a range of scores in that litter between 0.3 and 0.5, which you will see a range in a litter. Like we do entire litters, and you'll see a range that's, you know, over, you know, 15% or so. In this case, I made it, you know, 20, so 0.2. But you know, the average of both of these litters is 0.4. So it depends on who you pick out of that litter. If you pick 2 0.3s and breed them, you know, you're not going to get 0.3s, you're going to get 0.4. And so in that case, people go, this, you know, this PennHIP stuff doesn't work because we got worse. On the other hand, if you took the worst dogs from both litters and bred them 2.5s, you're going to think, wow, this really works great because we made, you know, all the puppies, you know, that their litter average is 0.4. So it's individual scores when we're looking at breeding that's one place where you're going to, think, how did this work? Because we bred these 2 dogs and their puppy scores were worse. On the other hand, you breed 2 dogs and you think, man, we're really cooking because they got so much better. But it really has to do with averages. And I think that's a big difference between what we're doing, where I have the whole litter and I'm tending to pick the better dogs, the better scores, not always. That's a lot different than you saved 1 puppy and then, later you test them. And so you really don't know what their litter average is. But so that's where we get some variability. And I think when I've heard people talk about using PennHIP, they'll say, well, it didn't seem to work because the litter was worse than the parents. That's really more of an indication of what their parents' litter average is than, and so that's an indication, looking back at ancestry, of what the true laxity in that line is, because you're getting a look at, what the whole litter is. Anytime you look at a litter, even if you have this range, you're going to have that phenotypically, but genetically, there's not that much difference between them. And so no matter which end of the spectrum in that litter range you pick from, you're going to, get offspring that are similar. So that's something that I don't, I haven't seen really reported, but it's something that we see here because we do all the puppies in the litter. But it's it doesn't change, my opinion of it, but it's just one of the variables as you're trying to make improvements. When you have 1 dog from a litter, approximately, how tight their hips are genetically in terms of what they're going to pass on to offspring. So and that's it for me. That was kind of it. It's the way that, we use PennHIP, and one of the challenges for us, is not only, finding Goldens and labs that are less than 0.3, but also just finding dogs that have had PennHIP at all, because there's, not a lot of veterinarians who do it, not a lot of dogs that we have access to their scores. So a lot of times we're breeding based on OFA, and so when I get scores back and I look at that litter average, I have an idea what the dog's PennHIP scores would be, what their laxity is based on their the litter average they produce. Hey, Kathy, you're muted.
Yeah, sorry about that. Anyways, thank you. That was a lot of really good information. And we have a couple of questions. And seriously, I've been a PennHIP believer for many, many years, done multiple generations, and have found it to be very, very useful. And you actually brought a few things to the table that I hadn't thought about before. So thank you for that. We had a question here that says, Matt had asked us if I've heard people talk about not exercising a pup too much. Will too much young exercise, do you feel, really affect the joint health?
Well, yes and no. I think the more laxity you have, the more impact that's going to make. I mean, if they have really tight hips, it's going to be minimal. I think there's been a lot more studies and evidence that weight has more to do with it than exercise, but obviously, too much trauma to joints is not a good thing, especially if you're exercising puppies that are, fat, really heavy, then that would definitely, affect their hips. But weight, when we're looking at something that's wear and tear, weight certainly adds to that. And there's been a lot of studies looking at puppies, trying to figure out, in fact, we did one here where we started radiographing puppies at 7 days of age. There was a couple of studies looking at when do the heads of the femurs start to ossify. So at 7 weeks, it looks like you're looking at some bones that are sort of in the same neighborhood because everything's cartilage. So you can't see the head of the femur. And there've been a couple studies looking at, if you can't start to see the head of the femur by the time they're 2 weeks of age, they're going to have hip dysplasia, which we found not to be true in about 50 of our puppies. But, you do have growing, developing hips and young cartilage, and, too much weight definitely is an issue. But if you combine that with exercise, I think you just compound it.
Perfect. Then the next question was, have you seen the DI score improve from puppies to adult as they continue to grow and develop?
No, not really. So I will say there is some variation between 16 weeks and 12 months. So, if you're doing them really early, there's about 85, 90% agreement. And it's on the tight side. So like if a puppy at 16 weeks has a loose, score, let's say it's puppy's 0.6, then at a year, they're probably going to be 0.6. But puppies that are tight, sometimes you'll have say it's like a 3.5 at 16 weeks. And at 12 months, they're a 0.4. It seems like the tight dogs will loosen a little bit. So there's a little bit of variation. If you looked at it statistically, it's not that significant. But once they get to a year of age, from a year on, you don't see any variation. Whatever they are at a year is what you're going to see. If you repeat it and do it when they're 10, it stays pretty consistent because especially at a year, pretty much all skeletal growth is over, at least 90% of it. And so whatever length that ligament is, that's the length of the ligament that they're going to have for the rest of their life. So it's pretty consistent.
That's really good information to know, because I know a lot of people don't want to spend the money at a year because they want to do both OFA and PennHIP. So they wait until 2 years of age. And that has been a discussion item if they were hurting themselves to wait until 2.
Well, it's just, it's more expensive to do PennHIP, obviously. That's another disadvantage. Especially if you've been able to do OFAs without any sedation, because you just absolutely have to have sedation for PennHIP. But it also costs a lot to keep a dog for another year. So
exactly.
It's just 2 years is a long time, and waiting. And then, I understand why everybody, really wants this dog to have good hips, but, it doesn't help if they have laxity and we don't know it.
So the question, because in OFA, the next question was waiting a little bit older in a female between the age of closer to 1. Do you feel that a heat cycle will affect the length of the ligament versus like it does in OFA?
No. Actually, they did a study with OFA, and they don't recommend you do it, but there wasn't very much effect from them being in season. But ideally, you would not do it while they're in heat. But that doesn't seem to have an effect on PennHIP.
The question Jesse asked here is, it seems that the 0.3 is the gold standard regardless of the breed average. If the breed average were 0.3, would the goal be to breed it to equal or less than 0.3? Or do you just still, I think I understood you to say that 0.3 is kind of that's just really good no matter what.
Right. 0.3 is good no matter what. 0.3 is sort of the universal line. So 2 things, like if you look at greyhounds, where you're looking at PennHIP scores and they're 0.09, right? Greyhounds, even though hip dysplasia technically, affects all breeds, for greyhounds, if you can't run, you don't get a breed. So, they have really, really tight hips. So, 0.3 is probably pretty sloppy for a greyhound, but, they're not going to ever have hip dysplasia. So, but there are some, like PennHIP's done a ton of studies, and one of them looked at like the Shepherds, Rottweilers, Goldens, and Labs, and the variation between them. And so if you look, at those specific breeds that have a lot of laxity, there's some variability, like I was saying, between the Shepherds and the Rottweilers and what they can typically tolerate. But we would still say, we're trying to get below 0.3. 0.3 is the magic number. And that's 30%. If you can't move your joint out of the sockets, you're not going to get hip dysplasia.
So with the standard of PennHIP suggesting that you breed equal to or lower than the breed average, we have had some concern in our national club with people concerned about that average going up as more dogs enter the database, and think that we're going to actually end up with worse hips because more dogs are in there. With so many golden retrievers in the database now, have you seen a lot of change from when you first started with just a few thousand to the 25,000 now, and what the overall breed average is? Did it ever go up?
No, it's just dropped. It's just dropped. I mean, it does depend on who, submits, and, there's some, there's going to be some chance it's going to happen. Now, I haven't looked at there. I could tell you how many Vizslas have been done. I'd have to go and try and find it, but
it's about 1,300. I just did one recently. So
yeah. So, I mean, with a smaller number, technically it could happen. What we've seen with Goldens is, I think when we started doing it, it was about 0.57 or 8. Now it's, it's moved down to 0.53. But, that breed average, does depend too on, who's submitting and, where those dogs are. But with 25,000, a dog here or there with a higher average is, because you're going to have some. You're going to have dogs come in that are 0.8 and some that are 0.3. So in a big group, it's going to average out. But you're the one. You're the one who gets to pick at what level you think is okay. So I mean, fortunately, I don't think that would happen with Vizslas as easily, just because the average is low. Vizslas as a breed just naturally have less laxity than like Goldens and Labs. So I don't know that you'd really see that. But I don't personally, I would not breed the breed. I don't breed the breed average. That's what PennHIP would recommend as a minimum. To me, like when we were talking about the litter average and how, like, when you breed one dog, it depends on where they were, what their litter average was. And that amount of that variability, that's kind of why I, instead of picking for 0.53 for Goldens, I'm picking more like 0.4, putting more pressure on it. So if I was breeding Vizslas, I would say 0.4, whatever the breed average is, be the minimum that I would pick. But I'd be picking 0.3 just to have a little fudge factor, because if you only have one dog from that litter, there's going to be a little more variation than when you're looking at the whole litter, like I'm able to.
Can I probably put that into just like a really big, huge perspective here, which be, as people start doing this, they might be surprised at what their current breeding stock is, which could be OFA goods, excellence, and fairs that could be as high as 0.5, 0.6 in that range. So then they have a pretty big leap to get back down to 0.4. But if they start selecting for their mates that come from hopefully a litter that's had more than one dog done, and they can see what the litter average is, they should be able to, through future generations keep lowering that number and lowering that number and getting us to that gold standard of 0.3, as long as we're all staying cognizant of what we're doing.
Yeah, so that it's not, anybody's over, we're just going to throw them out. It's like any genetic thing. And I've heard, my background's in therio, in reproduction. And so, I've heard internists where, oh, we got to get rid of all these dogs because this one dog had whatever. Well, if you get rid of all the carriers, pretty soon we don't have anybody to breed because everybody's carrying something. And so, if you have a dog that has more laxity, PennHIP lets you very definitively know, that you're breeding them. If you have a 0.5 and you're breeding them a 0.3, well, you're definitely going to make improvements. And so it lets you, be more selective and, more confident knowing that, we're going to keep this dog in the program, but we're going to manage the hips and, make slow improvement. Slow improvement is always, better than, rapid change when you're trying to preserve a lot of other traits as well.
Absolutely. For those people that have heard a lot of my talks, is that there are no absolutes in breeding. You just have to be cognizant of what you're dealing with and continue to work to improve.
Breed the best to the best and hope for the best.
You've got that right. I think I wanted to give a couple opportunities here to, I'm going to go ahead, if you don't mind taking down your screen sharing so we can bring up the.
Yeah. Figure out how to do that. I still can't see my cursor.
Okay. I wanted to give, Lindsay, I'd like you to unmute because you were a huge person to be able to hook us up with Dr. Bruner tonight. And I greatly appreciated that. So I didn't know if you wanted to speak up at all.
Oh, thanks. No, I just appreciate Kent speaking. I think for years I've spoken about what we did at Canine Assistants and what I've learned through Kent with PennHIP. And so it was really nice to have Kent share firsthand. So it's actually accurate coming from Kent.
Yes.
But I know that, through the years, he did Trader in, I think, 2001, and his OFA was fair, and then it went to excellent. And then to have his PennHIP score, I think has been really important as we look back. And I know, Kathy, you've done the same, and we have several other breeders who have looked back, but I do think it's super helpful. And I think seeing what it's done for a breed that typically has poor hip health is important for all of us. So thank you, Kent.
Yes,
you're welcome.
Absolutely.
Well, I do think I think PennHIP is more valuable in a way for Vizslas because, you're past the point of, having a lot of laxity in the breed. And Goldens, you're never going to get super tight if you don't know what the laxity is, but there's so many bad dogs. OFA, is going to eliminate all those. But with Vizslas, where your average is 0.4, you really need a test to get better. You're going to need a test that, is harder to pass, that gives you a different indication. So, while they're similar in looking for arthritis and conformation and that sort of stuff, knowing their laxity is where you really get to put the screws to hip dysplasia and improve overall.
It took me about 3 or 4 generations to really figure out how to use the data to understand it. And my earlier absolutes of what I thought would be okay for my PennHIP ratings compared to what I expect now are completely different. I saw that knowing that a dog was OFA good or OFA excellent, but was lax and had a 0.51 or a 0.55, it did come back. Breeding those dogs did come back to haunt me versus something that was tighter. I think that Melissa Lemke, as one of my co-hosts, I think she wanted to speak up for a second.
Okay.
You'll have to unmute yourself.
Yep. Can you hear me?
Can.
Yep.
Yeah, thank you. So one of the things that I'm a pharmacist by nature, and so I deal a lot with, not by nature, but by profession. And one of the things that's really struck me during this whole conversation is we're in the throes of medical screenings, right? We have medical screenings for prostate, medical screenings for mammograms, for breast cancers, all of these different screenings. And over the years, those screenings have changed. The recommendations and the guidelines have changed. So, and the pendulum has swung from one point to the other. It has gone from this is recommended, oh, wait a minute, let's not do prostate screenings anymore. Let's just do PSA. And then pretty soon they're not doing any of it. And it goes to the exact opposite. Incidences have increased. And then the pendulum comes down back into the middle. I think what has been really interesting for me though is just as I'm following that, there's always going to be evident or new guidelines that are going to be coming out. Things are going to be changing, but that the reason that things change is because of the guidelines and because of science and because of evidence-based medicine and evidence-based studies. And I think that when you look at that, and when I look at what OFA has done for the dogs in the past, is it was a really good tool when it came up. It was the only tool that was available. It was a tool that worked. It helped to decrease those incidences of hip dysplasia. And just like medicine and screenings and embracing the screenings for the better entire population health, I think everyone can agree that when we look at screenings, we're looking at improving the overall health of our population. This is kind of how I look at PennHIP, is that it's a new tool. It's based on science. It's based on evidence. All of the people are trained the exact same way. You use the same numbers. So you're not getting that rater bias, because every veterinarian probably positions those dogs just slightly different. Some use sedation, some don't use. And with the PennHIP, it is very strict. It goes in a very, very specific way. And it's really hard to mess the numbers up. It's really hard to manipulate those numbers. And PennHIP is one of the only things, from what I'm understanding, versus OFA, that can predict whether a dog is going to have hip dysplasia or not. Where OFA has a little bit harder time because you cannot do the laxity. So going back to the screenings, I just look at this as something that has progressed. We've progressed on, we have gone past where OFA can take us, because we're still, even if you, just as you were saying tonight, just as you were saying that if you have dogs that are excellent and they're bred to excellent, we don't know when it's going to pop up, of when that hip dysplasia is going to pop up. Even if you breed generation after generation after generation of excellence to excellence, there's still going to be that risk. This is something that seems to me that it gives us a better tool in regards to that. And I think that if we can look at this as a health screening and embrace what we do for ourselves, I think it's really important to be able to do that.
Yeah, both we're really, trying to evaluate risk. We're trying to predict the future in a way. But I agree with you. Like when OFA came out, it would massively improve hips because it got rid of all the really bad dogs. And then, I think I graduated from vet school in '89, and there hasn't really been a big change, since during my career in terms of getting rid of hip dysplasia and, really, improving doing OFA, because it kind of hit the wall once you got to which of the really good dogs are still going to produce dysplasia, because they're, those dogs are kind of like carrier in a sense. They're like passive carriers. They look great, and you feel like when you get an OFA excellent, you should be, oh man, I can just breed them to anybody, right? They're going to make everybody better. But I think what happened, too, especially people who are breeding, a fair number of dogs and using lines for a while, started, breeding is the other way to find out what you have, obviously, right? So, people would take OFA and then they'd know, okay, this excellence different from the other one a little bit. For some reason, this dog tends to produce better puppies. And you know, so some of that breeder knowledge and ancestral history combined with OFA, you know, you get a better idea of laxity, but not like with PennHIP. You know, it just gives you a better risk assessment, being able to measure it.
I'm not sure that you mentioned earlier on, but since you've implemented the PennHIP method in your breeding program at the Canine Assistants, when's the last time you've had a dog wash out for hip dysplasia?
It's been over 20 years. Now that's, I should also say that, you know, we're combining it with some other things like JPS that allows us, if we have laxity, to improve it. But, you know, all of our dogs are better than the breed average. You know, when you look at that chart, like at 0.4, you have less than 10%. And at 0.5, you're, you know, you're about 15%. So we don't expect any of those dogs to have problems unless the folks let them get really obese. So, yeah, it's been a while. There's, you know, and it fluctuates because we have to bring in new dogs, you know, and new lines, and we don't always, you know, like the PennHIP history of those dogs. So, you know, that affects us. So we see some variation, but we're able to keep it pretty tight, somewhere around 0.4 for Golden. So yeah, it's been a long time, you know, and that's been a gift to me when you look at breeds, and that's your number one orthopedic condition. It's one of the biggest issues in the breed, and you can eliminate it and focus on temperament and other things. You know, it's been a huge help to us. You know, now and the other thing is, you know, been doing it for, you know, over 20 years. So, you know, we also know how that plays out with the dogs that are out working every day. You know, do they have hip dysplasia? And it's been interesting because now that we don't see hip arthritis, at least not significant, you know, cases of it. You know, we see a lot more issues with their dogs' backs that we used to write off as hips and stuff like that. It's been very, very interesting, you know, as these dogs have aged and continued to work, you know, to see how that plays out in real time too. So it's been great for us.
Awesome. And I knew you don't have to go into it, but the question was, what does JPS stand for?
Oh, JPS is juvenile pubic symphysiodesis, which is why we call it JPS. And so it's a surgery that can be done when the puppies it's kind of between 4 and 6 months. And if they have more than 50% laxity on each side, it's about a 30-minute surgery to fuse your pelvis, and then it changes the way the pelvis grows. Essentially what it does is it rotates the cup over the ball, so that even if they have laxity, it doesn't matter. So for us, that's been a great surgery, because those dogs end up with the best hips we have. But it also allows them to stay in the program. So
that's awesome. And because you can check the laxity at 16 weeks of age, that's a huge help.
Yeah. I mean, it's not something that really applies to anybody else. I mean, because people aren't taking their new puppy in at 4 months and having PennHIP done. But for us, you know, when we've needed to use it, you know, it's been a big help. It's been great.
Well, you have given us a wonderful amount of information tonight. I cannot thank you enough. And it's really helpful. And I foresee us possibly getting you to do a future education for our club as a whole at some point in the future. But thank you. If anybody has any last questions or wants to give a thumbs up in the chat to see if you enjoyed this. But once again, Dr. Bruner, thank you so much.
Thank you so much, Ken.
My pleasure. Always glad to throw my 2 cents out there.
Good night, everybody.
Good night.
That's at least 5 cents.
Can I ask one question?
Yeah.
I hear a lot in the hunting dog community, you know, that when a pup's like 5, 6, 7, 8 months old, you don't, you know, as far as like hunting it too much, can that affect the ligament length, so that when you go in for the PennHIP at like 12 months, 16 months, you get a different laxity score? Or is that just have nothing to do with that?
Yeah, I don't think so. You know, again, it depends if, you know, if you're, you know, in a dog who's less than 30%, no. But if the dog's 90%, yeah, more, you know, you've already started the wear and tear that's going to eventually turn into dysplasia. So I would say there, it would affect a dog with more laxity. The more laxity you have, the more
Okay.
that would affect them. But if they're tight, they're tight. You know, you just.
So that ligament length isn't changing by maybe a dog that runs around more in the field or woods.
Not that we know of. You
Okay,
know,
thank
it's,
you.
Okay, folks, that's it. So have a good night, and we'll probably have another chat sometime in end of October. Thank you again. Good night.
enjoyed it. Thank you. Good luck, everybody.
Thank you so much.